Hi, my name is Jyoti Pillai. I am the program director for the adult neurology residency at Reading Hospital. I have the privilege of being a neurology residency program director at Hahnemann University Hospital and Drexel University College of Medicine. I have been the program director there since 2006. I actually joined Reading Hospital because they wanted to establish a neurology residency program. This is a categorical program, which means that the residents train for 4 years. The first year is the preliminary year in internal medicine, and the next 3 years are going to be in the adult neurology residency training. We have been approved for 24 residency slots, which is 6 residents per year. I personally feel that this is the best time to be in neurology because there's so many new therapies. So I want to see a resident who has a passion to learn about neurology, the passion to take care of patients with neurological disorders, the passion to be a leader. So you're going to find the faculty to be role models of professionalism. They are going to be very approachable. At the same time, they're going to teach you the skills of communication with a diverse group of patient population that we have at Reading Hospital. Reading Hospital is a very busy hospital with a large volume of patients in all specialties, and that also includes neurology. So you're going to be exposed to a high volume of patients with diverse neurological disorders, which includes stroke and cerebrovascular disorders, epileptic disorders, neurodegenerative disorders, demyelinating disorders, cognitive and behavioral disorders, movement disorders, sleep disorders, and patients getting admitted to the neurocritical care service. This will allow you to be a well-rounded neurologist who will not be afraid to deal with any kind of neurological emergency or even managing patients in the outpatient setting. Your day would be either you're on the inpatient rotation or on the outpatient rotation. If you're on the inpatient rotation, you could be on a neurocritical care service, or you could be on the stroke service, or you could be on the inpatient consult service, or you could be on the inpatient ward service, primary neurology ward service. If you're on the inpatient service, you see the patients in the morning before the attending starts rounding. You present those patients on rounds to the neurology attending on the respective service that you are taking care of. There will also be conferences in the around noon time, almost happening daily. And at the end of the day, before your shift ends, you sign out to the oncoming on-call resident, which would typically be around 5 o'clock. And if you're on call, you stay back in the hospital, which is going to be an inpatient in-house call, and you will be doing overnight call, and the next day morning you when you're done call, you sign out at around 8 a.m. to the neurology floor or the consult residents. And we do care about work-life balance for everyone, including the faculty and residents. We are going to strictly adhere to the ACGME duty hour, which is not exceeding 80 hours per week, averaged over a 4-week period. And we want our residents to learn at the same time, be happy with a good work-life balance. Reading Hospital, being the flagship of Tower Health, is immensely helpful for the resources that you as residents are going to need to complete a successful training during a residency. The Reading Hospital has all these other residencies, which includes internal medicine, family medicine. That will allow the residents to become a good neurologist with a broad knowledge base of the other specialties. Residents are going to be required or mandated to do a research project during their 4 years of training before they graduate. There's going to be ample opportunity to do clinical research with using the faculty mentor of their choice or the subspecialty that they choose. If they choose to do a fellowship after their residency, they could easily pick a mentor or faculty mentor of that subspecialty. The ACGME requires 3 months of training in child neurology, for which the residents are going to rotate at St. Christopher's Hospital for Children, which is in downtown Philadelphia. Once you're done with your residency program, you are going to be a great clinician, a neurologist, who's going to be able to take care of patients with neurological disorders in the community. and you will also be capable of being an academic neurologist, and you will have the capability of applying to subspecialty fellowship programs of your choice after you graduate from a program. When I see my residents graduate and go into great fellowship programs, that makes my day that I have been an effective teacher and I am able to train residents who are going to be future neurologists. I'm building a generation of excellent neurologists who will do good